So I think in summary, with the approval of osimertinib as a frontline treatment of EGFR mutant lung cancer, I think it changed the landscape of how we treat EGFR mutant lung cancer. In the past, we give drugs that have fair amount of side effects such as rash and diarrhea, but with the introduction of osimertinib, I think side effects profile is solved, and we have a very good progression-free survival of about 18.9 months. With the additional abstract that shows that osimertinib is also has clinical benefit in uncommon mutations, EGFR common mutations, we potentially can also expand the use of osimertinib to these 3 uncommon mutations. And if the ADDURA study is positive, then we may even see osimertinib as a adjuvant use in EGFR mutant lung cancer. So what are the questions we are faced with in the future, the unmet need that we can anticipate? Is that the resistant osimertinib? So we need to biopsy at disease progression, most likely with liquid biopsy, maybe augmented with tissue biopsy if we don't find any resistant mutations, and then we will have to combine different inhibitor with osimertinib for the specific type of resistant mutations, with the probable exception of small cell transformation. Osimertinib is very well tolerated. The dose that was selected at 80 milligrams is way below the maximum tolerated dose of 240 milligrams. So even if there is drug-drug interaction that increased the dose, increased the exposure of osimertinib, it's still very well tolerated. Another unknown or at least not approved indication is for the use of osimertinib in brain metastases and even leptomeningeal metastases. That is the dose that has been investigated for leptomeningeal carcinomatosis is about 160 milligrams once a day. It's twice the approved dose of 80 milligrams. So sometimes we may not get insurance approval for the use of 160 milligrams. So we would like to see the more systemic and more data on CNS metastasis and leptomeningeal carcinomatosis so that we can use osimertinib at 160 milligrams for their indications. So those are the, I think, challenges that we face going forward with EGFR mutant lung cancer, and we look forward to see if we can get a 4th generation EGFR TKI in the future that would help the patients.